this session is part of the Digital Health Uptake project. This is a coordination and support action to accelerate the uptake of digital health solutions all over Europe. The project is coming to an end. It's ending in October, and we are producing one of the pieces of this project related to digital mental health. This will be a policy brief that is already available, one executive digest on the website that I think you see in the registration process. But the result of this workshop will be elements that will also enrich the policy brief that will be published at the end of this month. So thank you for your participation, and we encourage you that you will engage in the discussions on how we can improve the effectiveness of implementing digital mental health. Our approach for this session is we want to look at large scale up. So how health system can encourage the implementation of digital mental health across the country or the territory or the region. For that reason, we have invited two experiences. One experience that comes from Catalonia in Spain, and this experience will be presented by Enrique Arroyo. He's the director of in healthcare innovation in Parc Hospital. It's a university hospital in Sabadell, in Catalonia. And he will be presenting the Mental Health Catalonia project. This is a project that is in the process of planning an early deployment, but this is still not deployed. So we will learn on the approach, how they are approaching to deploy digital mental health across the Catalan health system, which is a diverse and in some way complex health system. The second presenter, Robb, she's program manager at Digital Health and Care Scotland, and she will bring the experience of the Scottish government of deploying digital mental health tools, and specifically some called NIME related to different mental health conditions. In their case, they have already implemented, so we will learn first-hand experience in deploying digital mental health in Scotland.
I'm Enrique Arroyo, the head of innovation here in Parc Taulí, that it's a hospital near Barcelona. And as Tino was explaining, I'm here to present you how are we thinking about the digital solutions that we want to implement in the frame of this project, and also the deployment strategy that we are starting to implement in the project. I'm going to present the project at the first part of my presentation, and then I will move on to the deployment strategy and also the main barriers and challenges that we are facing in the implementation of the project. So just to give you a quick overview about how is the existing situation in Spain for mental health. As the majority of the countries in Europe, the general situation in mental health after COVID has been really worse, and the studies here that we are doing in Spain talk about almost 30% of the general population would suffer mental health diseases. And now in the hospital level and also in the primary care level, we are able to assist only the 5% of the population. So we have a clear mismatch between the population need and the healthcare capabilities to serve this need. Then also almost 75% of the people who have mental health diseases do not receive the proper help. Here in Spain, the care process works a person first goes to a general practitioner who does a general interview, and taking what the patient says and the system, the general doctor decide to derivate the case to the hospital level. This process not in all cases work very well. So we have a lot of people who are having a treatment that it's not really correct. And then half of the diagnosis, the first diagnosis that we do, are wrong, and we have to change it in the near future. And there's a lack of digital tools and capabilities for the professionals and the patients. And the majority of the professionals are demanding and are asking to have more tools to try to serve to more people and to have more information about their patients. And this is why this project has been created, and this is one of the objectives that we wanna achieve. So if we move on to the next slide, I will give you a general background of the project. Here in Spain, in Catalonia, in Spain is divided into 17 regions. I'm talking about Catalonia, that it's one of the most important ones. The government has decided to choose only 18 transformation projects to be tested in different hospitals, and in case the results are really good, to scale this solution to all the systems. Mental Health Catalonia is the unique project related to mental health of these 18 projects that the government has chosen. So it's a great opportunity to test interesting things that maybe in the near future will be applied to all the territory. The fundings that we have received come from the Next Gen funds. The timing that we have, the project starts last year, and the deadline is May 26. So we are almost 1 year and a half to end the project. This is why I will talk about a lot of the definition and the contracts that we are starting. But in the next 1 year and a half, we will see the concrete results. And this project is led by Taulí Hospital, but in this project also collaborates other hospitals that are near Barcelona, as Clínic, Mutua de Terrassa, and Hospital del Mar. So if we enter deeply in the project, we have mainly two objectives. One, that it's to introduce digital solutions in the existing care process that we are doing for the patients, and try to build a digital platform that can receive all real-time data from the patient in order to know what is doing the patient in all the time, and if something happened in the meantime between visit and visit, do a proactive actions to be proactive and to avoid having an hospitalization or maybe having a suicide episode. If we talk in concrete, what are the solutions that we are proposing are mainly three. One, that it's in the prevention side. Here in Spain, we have a huge problem in accessibility. So what we want to offer is, sorry, because I'm seeing all the chats notification working all the time. If you wait until I finish the presentation, if you have any comment or question, if we can wait until the end, it will be highly appreciated. So what I was saying, the first solution is related to prevention, and here what we want to offer is a tool that allows the patient to do a self-assessment and to see that if they think that they might have a mental disease, and this tool confirms the situation, the tool will propose directly to fix an appointment with the doctor and start like the current care process. So this first solution will be targeted for general population, and then the solution number 2 and number 3 are target for our existing patients. The digital therapies, what we want to offer is digital programs that the patients can follow between on-site visit with their psychologist or psychiatrist. It's like we want to empower the patient to do exercise at home and to control or do exercise that can reduce the effects of the disease in order to increase and to improve the recovery process. And the third solution is for the patients that we have in really high risk that may have been discharged very recently. What we want to know is what's going on in their lives after the discharge moment. It's like if they go out home, how they sleep, how many hours they use the cell phone, if they have or not social interactions, if they are taking the medication that is prescribed, in order to have all this information, and if something is going wrong, having the information to contact directly to the patient and fix an advanced appointment to see what's going on. So in the next slide, I just want to put some examples of what we are presenting. This will be like the patient journey of the digital mental health assessment, where the patient it's a mobile app that it's anonymous. We don't ask the identity of the patient. They will access to a website or to an app to see or to answer some questions about their daily activity. And depending on the results of this clinical test, some actions will be proposed. As an option could be confirm the satisfactory mental situation, or in cases that we identify some problems, the system will propose to fix an appointment with the general doctor in the primary care center, and will be linked directly to the primary care software in order to give some visibility to the general doctor about the results of the test, and use the time they have to deep dive more in the insights or in the situation of the patient to decide if this case will be derivated to the hospital or not. Apart from this digital assessment, we are proposing to build a website where the patient can find information that is scientific validated, that we will have some exercise that the patients can do at home explained by doctors and nurses, and also videos that will be participating with our patients, explaining their experience in the hospital, and trying like to incentivize or promote to take actions to the people that they may have problems of mental health, but they haven't start like to go to see the doctor and start like the clinical care process. So if we move on to the next slide, you will see an MVP of this kind of videos that will be accessible for the general population of our geographical area. Then, if we move to the next slide, I would like to present the second and the third solution of the project, that it's mainly passive monitoring. What we have seen in the studies that we have done is like when the patients have been discharged some days or months ago, they are not willing to interact actively with digital apps or digital tools. So what we are proposing is like to receive information from the real situation of the patient, which is his physical activity, the number of hours that they are sleeping, and compare these hours with the medication they are taking, the mobile use that they are doing, if they are super exposed to the phone, and this may have interactions with their social activity, or if they have left the medication that has been prescribed by the doctor. With all this information, what we want to build is a set of alerts that will be received to digital advisors that can be nurses or other kind of professionals that will review this information case by case, will contact directly to the patient or to the caregiver or to the family member, just to confirm that the information that we have received is real. And if this is confirmed, this case will be automatically derived to the doctor to fix an on-site visit the following day. What we want to do with this new care process is like to try to anticipate some problems that the patient may have, that for a lack of a proactive intervention we wait maybe for 2, 3, or 4 weeks, and finally the patient will come to the hospital in a really bad situation. We want to prevent this by having rich information that we can manage in advance. In this case, what we have been doing the last month is to test a market solution that already exists in Spain, and we have selected almost 60 patients, 30 adults and 30 teenagers, to test the solutions in real conditions, in order like to have more information to define which will be the solution we want to offer to our patients. So if we move on in the presentation, this is just an example that the reports that we are creating to be shared with the patient and also with the professionals. The first one is related to the sleep. When do they start sleeping and they finish sleeping, and the number of hours that they are sleeping. The second graph is related to the physical activity, the number of kilometers and steps that they do daily, and this allowed us to fix concrete objectives to the patients that will be reviewed in the following visit. And the two graphs that you have on the bottom of the slide is the use of the cell phone. On the right, we have the number of hours that the patient is using the phone, taking into account that more of 5 hours will be something to be reviewed in detail, and also which are the hours of the day that they normally use the cell phone. Is they use mainly at night, in the morning, in the evening, and depending on this, we propose different actions to be done by the patient. So in this slide, I want to present like the deployment strategy that we want to follow in the project. As Tino was saying at the beginning, we started the project last year, and we are finishing and starting building the solutions that I just explained to you. In the digital self-assessment tool, what we are proposing is a public procurement agreement, what means that the hospital has been defining the content and the customer and the patient journey that the mobile app should have. And what we are looking for here is to assign this agreement to a technological company that can develop and implement the solution in the hospital, taking into account the clinical knowledge that all our team has. Then in the second part, where the digital platform, like to get real-time data, here what we're gonna do here in Spain, the law allowed us to do a public innovation acquisition, what means that we can acquire a startup or maybe a solution that it's not fully deployed, but at least they may have an MVP or a proof of concept that has been proved in some hospitals, and help the startup to have more capabilities that we think that are important for our patients, and to help this company to have a solution that can be used in our hospital and share the ownership of this product in the future. So here what we are offering is more a partnership agreement, buying what the startup has done at the beginning and building with them what it's missing, or what we think that the solution needs at the present moment. And also we are in the third block on the bottom of slide, we are developing some voice predictive models in order to give some support to the patient, give some support to the doctor to assess if the patient may have or not depression. And this is a development that we are doing in-house. We have hired some engineers, experts in the voice analysis, and in both sides, analyzing what the patient says in order to do reported speech and cross what the patient says with the words that we think that are an alert, or that we have to review. If the patient talks about death, this is something that we have to take into consideration. And a part of what they say, how do they say it? Like the intonation, like the silence that they may do between different words. This is information that is very useful when we compare the voice of a concrete patient with a database that we are building right now. And this is something that we are doing fully in-house. And talking about the challenges and the barriers that we think so far, I think that here in this webinar we will have some opportunities to discuss it later. But I just wanted to comment 5 of them. For us, it's been very tough, all the bureaucratic processes that we have to follow to assign work to private companies. As a public entity, we have to accomplish a lot of processes, a lot of administrative things that may steal a lot of time of the research and of use this solution with patients. So this is something that it's really time consuming. Another thing that I think that it's really important, it's all the change management that we have to do with our healthcare professionals. Normally, they are not used to do or to work with digital tools, and this is something that we have to train and to help them to this new process. This is something that will be very progressive, but we cannot leave the professionals with the tool without an explanation, without having someone that helps them through this process, because otherwise we may have the tool, but they will not use it. And the final objective is to let the patients use the solutions, and also the professionals. Talking about the funding programs, from my perspective, I think that historically we have had very short and medium term perspective for this kind of programs. I think that a huge change in organizations we cannot be planned in 2-3 years or 1 year's time. This needs a really funding program behind for a long-term perspective, and also the compromise of the management of the healthcare institutions, that they will support the researchers and the teams that are trying to make this happen, because we will find a lot of problems and difficulties along the way, but we have to feel that we have someone behind us that help and try to make this happen, and they want to have this solution in our existing processes. And I also point out another barrier that it's called like fragmented IT infrastructure. This may be a specific barrier in Spain. I really don't know the case in other countries in Europe, but here in Spain, as I said at the beginning, we have 17 regions, and each region has their IT systems. So in case that the healthcare government of Spain wants to deploy and implement a successful solution that has been tested in Catalonia, we will have to do several integrations to see this happen in other regions of Spain. This makes the process very hard and very complicated. And I think that this is something very, very costly and very difficult to solve. I know that there are some initiatives to create different platforms in order to share information, but this is something that will be very crucial in the near future.
So my name is Robb, and I'm a programme manager working on the Digital Mental Health programme within Scottish Government. So today I will be talking about implementing digital mental health in Scotland, the standardised approach we use, and some of the challenges and enablers. So there are 4 broad areas of work in the implementation at scale, which is very process driven. Firstly, the assessment of digital assessments, procurement, and implementation. Next, looking at the service transformation, whether that be design or redesign, and the delivery of the technology. And also understanding and developing the infrastructure for sustainable delivery, and driving up adoption through cultural change and inclusion. So I just wanted to highlight this image because it actually highlights some of these broad areas, allowing a process-driven implementation model. So you can see here within the test and learn phase, we look at the assessment and the service transformation, and in the proof of concept and test of change approach. We then move into infrastructure and adoption areas, which sit within the process-driven implementation that you can see at the top there. Now, this was just to highlight it. I am going to break it down a wee bit more in the next few slides to make it a bit more clearer. So, within the test and learn approach, it consists of a number of stages, which transitions from the testing and learning phase into large-scale implementation. Now, it's important to note that this phase takes time. The aim is to ensure good initial testing, development of processes that helps ensure that less time is required to spread to new services. So making it easy to use and easy to implement as well. And at this stage, we use improvement methodologies, which are adopted from a proof of concept to large-scale test of change. So this involves testing the technology and developing service processes and testing these, and also bringing into this different variables. So if you had more staff coming on or different users, you're constantly testing. With this as well, staff training is essential. However, it is important to make this as easy as possible, such as having drop-in sessions or useful guides or numerous videos that aren't too long. Now, programme management manages and monitors this phase to manage expectations, timescales, reporting and risks, and also the collation of feedback, including any barriers, as it is essential to capture these at an early stage. The development of the system security policy and data protection impact assessment within Scotland, these are approved nationally. So this is part of the information governance. So this helps implementation locally as it's approved nationally. Now, within the test and learn phase, you're continuously information gathering, both quantitative and qualitative, as this helps with engagement and the value of the technology and also building that evidence base. So the outcome of the test and learn phase is the development of a standardised implementation approach to IT implementation, change management, workforce training, service development and delivery, and identifying sustainability requirements. So this actually helps provide a step-by-step procedural approach, which enables the replication across each locality to spread and scale. The key to this implementation is to keep it simple and having an approach which is replicable despite what technology you are trying to implement. In parallel, work is done to increase acceptance and address negative perceptions. This is very evidence-driven. So this is largely done with engagement with local services, both clinical and users, the use of promotion and marketing, so i.e. social media, posters, knowledge events, collaborating and partnerships as well. So the infrastructure is being developed during the test and learn phase, pardon me, and scaled up to ensure business as usual. So as with any digital technologies, legacies and support requirements need to be maintained. And in Scotland, this is through ensuring it is continued in strategic and policy development and IT contract management as well. So now onto the challenges of implementing and upscaling digital mental health. So I'm just going to highlight some of the challenges and some of the mitigations as well. So resistance, which can include clinical acceptance, capacity and pressure. However, some mitigations to look at these barriers is the evidence, engagement, partnership and collaborating can help with that challenge. And with any new design or redesign, it takes time and effort to integrate that too. So the test and learn phase is really important because at that stage you can create service processes, and this could be shared with other localities, and that actually saves other localities reinventing the wheel. You can share that learning, and also hosting improvement collaboratives can also share the learning, the processes and any lessons learned as well. Now in Scotland, there are 14 territorial boards. Therefore, there can be slight inconsistencies in delivery approaches. Yet having a national approach to facilitate information government processes and integration across policy development and national programmes can help elevate some of these barriers. Another barrier could be having the appropriate equipment, so supporting local areas to get the appropriate hardware, and also training as well is very important too. And also people are not digitally excluded from using services, so the technology should be intuitive to design for users. In Scotland, we have hubs and libraries that enable users to access devices or support, and we've also got programs for digital champions as well that can help. Funding, so having that evidence to support impact and value, and also having a population approach to contracting to continuously grow services as well. So I'm going to move on to a bit of a more positive note now. So enablers within our programmes that support us to achieve implementation nationally. So we have got a continued focus on outcomes and core vision to achieve scaled implementation. Now, local implementation is supported by national expertise and programme management. And this actually allows national teams to support without actually reducing local ownership to enable that sustainability and to move into that business as usual phase. As I was mentioning, programme management is important it supports the planning with partners, allowing open and transparent discussions, and also identifying risks, reporting requirements, and the roles and responsibilities. And also within that test and learn phase is doing the project and IT readiness. So bringing teams together to make sure, they've got the project teams, their ITs there, do they need any additional training or devices? And also another enabler is having leadership, as this helps with awareness and encouragement, facilitation. And also we have a lot of showcase events to share some of this learning and to share some of the examples. Now in Scotland, we have a national procurement structure. So this helps standardise implementation processes, which removes the local barriers to implement as it's done nationally. Now, data is made available locally and nationally, and this is built into the implementation and service delivery models. This also includes user experience from clinical and care staff, people with lived experience, policy leads, etc., which helps build on that evidence on the impact and value of the technology. Now, we work with a portfolio of programmes managed centrally, so that allows the interconnectivity between national programmes to share their skills, their resources, experience, and to be able to collaborate. And that is the end of my slides. So thank you very much for taking time to listen to me.